The Food and Drug Administration will decide tomorrow whether some vaccinated people should get COVID-19 booster shots. The meeting comes as health officials have confirmed more than 41 million coronavirus cases and nearly 667,000 deaths in the United States. The spread of the Delta variant is impacting hospitals across the country. Some intensive care units in the South are at 100% capacity. That is forcing medical staff to turn away non-COVID patients. According to the CDC, nearly 64% of the U.S. population has received at least one dose of the vaccine. CBS's Bradley Blackburn has more.
The COVID-19 vaccines got a holy endorsement on Wednesday. Pope Francis told reporters that humanity has a history of friendship with vaccines and urged everyone to get their shots. Here in the U.S., a key meeting for possible booster shots happens tomorrow. The FDA released new documents from Pfizer ahead of an advisory panel's meeting, claiming that protection from its vaccine loses some effectiveness after 6 months, but improves to 95% after a third dose. FDA staff noted in a separate document that they've yet to verify some data that would support a booster, saying the current vaccines, quote, still afford protection against severe COVID-19 disease and death in the United States.
This is a pandemic of the unvaccinated.
President Biden met with executives from Microsoft, Disney, and others to urge companies to mandate vaccines for their employees.
Vaccination is key to getting the pandemic under control and keeping the economy strong.
Just 63% of the eligible population is fully vaccinated. In Los Angeles County, a new health order is being issued that will require proof of vaccination or a negative test for large outdoor events like Dodgers games. Proof of vaccination will also be needed to go inside bars and other drinking establishments. Bar Kahlo has been doing it for weeks.
Everybody's been really cool about it. They want to get it back to normal.
People will need one shot by October 7th and be fully vaccinated by November 4th. Bradley Blackburn, CBS News.
For more, I want to bring in Dr. Marcos Mestre. He is Vice President and Chief Medical Officer at Nicklaus Children's Hospital in Miami. Dr. Mestre, welcome. The FDA has released details on Pfizer's booster shot application. It finds no major safety concerns, yet there still seems to be some disagreement on whether the general population should get these boosters. How do you think this is going to play out, and what is your professional opinion from the science you've seen?
Yeah, so what we're seeing right now in terms of the boosters coming out, what we are trying to determine is does this, number one, prevent infection, as we've seen many vaccinated individuals have been infected, and does it prevent the spread of infection as well? In addition to that, does it have any changes in terms of risk of mortality or being hospitalized? As we've seen, thankfully, during this time, even though individuals are getting infected, it is preventing those that are vaccinated to be in the hospital. So I understand where the FDA is coming from in terms of trying to determine, is this worthwhile to move forward with it? Most likely what we're going to see, we get a lot of data from Israel during this pandemic. They're always a few months ahead of us, and from what it seems like, those that are at highest risk for infections from COVID and hospitalizations, such as those over 60 years old, seem to get the most benefit from a booster immunization.
And, you know, hospitals right now are struggling to treat non-COVID patients because of overfilled ICUs. COVID cases are growing among children, and of course, influenza season is approaching. So how concerned are you about the upcoming winter months, and how should we all be preparing, but especially parents?
Yeah, we're very concerned about it. Obviously, because of the unknown, right? Last year, during the summer, during the pandemic, we didn't see these large waves of RSV and influenza that we're seeing nowadays. And what makes us most concerned about it is that if all this comes in together. So what we're recommending to parents, everybody 12 years of age and above for the COVID vaccine, to please go and get vaccinated. That'll help prevent not only infection to the individuals that get vaccinated, but to those that can't get vaccinated in the home, such as those that are 12 years of age and under 12 years of age. And we do recommend, obviously, for everybody 6 months of age and above to go ahead and get your influenza vaccine as soon as possible.
And so, doctor, what is your advice to patients who are sick, but not from COVID, but who need immediate medical assistance if they're unable to see a doctor right away or get into a hospital due to lack of beds, especially if you have a child? I mean, we heard this really sad case of a poor child who was suffering from appendicitis and had to wait an extremely long time just to get a bed. What advice do you have for those parents?
Yeah, so it's been a challenge across every organization and every hospital across the country, not only from space, but also from staffing issues that our hospitals are having. So what I do recommend is making sure that they keep in close touch with their pediatrician or their regular physician. And if they need to come to, not be afraid to come to the hospital for emergency care. And making sure that folks understand that what you're there for. Especially in adult hospitals where they have a greater majority of the COVID cases, you do have to speak out and make sure that they know that you're there for a non-COVID issue so they can take care of that. What we're seeing, though, is a lot of elective cases are being canceled, and some of these emergent cases may not get the immediate attention that you need. But to make sure that to be the voice for, number one, yourself as a patient, and if it's for your child, to be the voice for your child.
Such important advice. Dr. Marcos Mestre, thank you so much for joining us. We appreciate it.